The Centers for Disease Control in Atlanta estimates that each year about 300,000 Americans contract Lyme disease, but that only a tenth of those cases are actually reported. And that is a big problem.
Experts say one reason for such low numbers of cases reported is that the standard test for Lyme is flawed. It's accurate less than 50% of the time. Well, this is Tick Week here at News Center Maine. We are bringing you the latest information on research, treatment, and prevention against ticks and the diseases they carry. News Center Maine's Vivian Lee has details now of a new Lyme testing method that claims to be far more precise in detecting the disease, especially in the early stages. Right, Viv?
Yes, Cindy, that's right. In studies, the new two-step test made by Zeus Scientific and cleared by the FDA showed a marked improvement in picking up a person's immune response in the first month of infection. And that's when Lyme disease, of course, can be successfully treated. If left undiagnosed, it can result in lingering symptoms.
For 25 years, it's been the only standard test for Lyme disease that's recommended by the CDC. The process involves a two-step blood test. The first test administered is called an ELISA, and the second, the Western blot. Both must be positive to indicate a diagnosis of Lyme disease. But it's often unreliable in catching the disease early because a patient's immune response may not be detectable. Dr. Sean McCloy is a medical doctor who diagnoses and treats patients for Lyme and tick-borne diseases.
If clinicians are over-reliant on waiting for that positive test to come along, they may miss the diagnosis.
For Lyme disease, you really want to hone in on this bacteria, right? The Borrelia burgdorferi.
Chris Howard is the chief commercial officer at Zeus Scientific. The New Jersey-based company develops, manufactures, and sells diagnostic test kits for infectious and autoimmune diseases, including Lyme. Howard says the Western blot test can take more than a week to run and is not very responsive in picking up Lyme in the early stages.
So you could be a sort of quote-unquote theoretically positive patient, but if you hadn't developed enough antibody, the test would be negative.
In an effort to come up with a better test, the company decided to replace the Western blot with an ELISA test in the second step. The modified test process was faster and easier to run for labs and showed a big improvement in detecting the antibodies against Lyme.
We picked up 27% more acute early Lyme cases than the previous method was. And in that methodology, we actually picked up 22% more in stage 2 Lyme as well.
Zeus's new algorithm of running two tests at the same time was approved by the FDA last summer. Howard believes this method will lead to faster diagnosis, treatment, and better outcomes for Lyme patients, but says more work needs to be done.
This isn't a so-called quote-unquote silver bullet. It's not going to change everything for everybody, but from what we've seen, it makes a marked improvement over what was in there right now. It gives you better results and it gives it to you faster.
Now, the pandemic delayed a big rollout of this test across the country, but a number of labs are starting to use it, including the Mayo Clinic and soon possibly at Mass General Hospital. No labs in Maine just yet, and of course we'll keep on top of that. And real quickly, I just wanted to let you guys know tomorrow we'll talk about the effects of mental health is having on Lyme disease. We'll hear a heartbreaking story from a Mid-Coast woman who wants to share her story to help others. Back to you, Cindy.
All right, Vivian, thank you. If you want to see all of the latest information on ticks and the diseases they carry, pick up your cell phone and text the word ticks to 828-6622. We will text you back a link to our tick webpage.
You can also go to our website, newscentermaine.com, click on the words Tracking Ticks near the top of our homepage.